Alzheimer's disease is a progressive brain disorder that can cause behavioral abnormalities, memory loss, and cognitive difficulties, which is common cause of dementia. As the condition advances, it significantly impacts a person's ability to perform everyday tasks such as cleaning, cooking, and even recognizing loved ones. Key risk factors for Alzheimer's include advancing age, a family history of the disease, and certain medical conditions like diabetes, high blood pressure, and cardiovascular issues. Lifestyle factors such as poor diet, lack of exercise, and insufficient mental stimulation may also contribute to its development. There is no cure for Alzheimer's disease. However, regular physical activity, a nutritious diet, and mental exercise have been shown to slow disease progression in some cases. F.I.T.T stands for frequency, intensity, time, and type. Big protocol for aerobic exercise is for frequency. It's aimed to walk 5 to 7 days per week. In terms of intensity, it should be done at moderate to vigorous pace. Ideally, heart rate should be 50 to 70% of maximum heart rate for moderate intensity. For time, do it at least for 30 minutes per session. We can split to 2 sessions, which is, for example, 50 minutes in the morning and 50 minutes in the evening. As for type for aerobic exercise, is brisk walking.
Alzheimer patients also is advised to do a muscle strengthening activity. For the frequency, they are advised to do 2 days per week and increasing over time. For the intensity, they are advised to do 40 to 50% of 1 RM for the beginner and 60 to 70% of 1 RM for the advanced exerciser. For the time, they are advised to do 1 to 3 sets with 10 to 50 repetitions per set. For the type, they are advised to do soft weight training.
I will talk about F.I.T.T protocol of balance exercise. For frequency, the person must do 2 until 3 days per week. Regular practice can improve balance and reduce risk of falls. Next, for intensity, the exercise must perform at moderate intensity and make sure it is challenging yet safe. Moderate intensity are effective for improving balance without causing undue fatigue. For time, each session should last 20 to 30 minutes, including warm-up and cool-down periods. It is sufficient to achieve benefits for individuals' intention and participation. The study also indicates that home-based exercise program for this length can improve balance and reduce fear of falling in older adults with mild Alzheimer's disease. And the type of this balance exercise is Hill to 2 walks.
We also encourage Alzheimer's patients to engage in flexibility exercise for at least 2 to 3 days per week, with daily being most effective. Recommended intensity level will be full extension, flexion, rotation, or stretch to the point of slight discomfort. We can hold a static stretch for 10 to 30 seconds with 2 to 4 repetitions of each exercise. Type of exercise suggested is slow, static stretches for all major muscle groups.
For brisk walking, start by walking slowly for 5 to 10 minutes to warm up the body. Then, walk faster than your normal pace. Take a quick, short steps instead of long strides, and breathe deeply in a steady rhythm.
When doing the brisk walking, make sure your shoulder is relaxed, your back is straight and head up, and swing your hands naturally.
For the muscle strengthening exercise, firstly, stand tall with your feet hip wide apart. Then, place 1 dumbbell in each hand and stay relaxed with your palm facing forward. Keep your upper arms stable and your shoulder relaxed. Then bend your arms up the way to your shoulder. Exhale while lift up the weight. Repeat for 10 to 50 repetitions for 1 set. Repeat until 3 sets.
For balance exercise step, first, you must stand up straight with your head up and eyes looks forwardly. Next, place your right foot in front of your left foot. So your right heel will touch the top of your left toes. And then repeat this step with your left. Lastly, work for a set number of steps.
The sequence of flexibility exercise is neck, shoulders, chest, thighs, hamstrings, quadriceps, calves, lower back, wrists, and ankles. You can choose to sit or stand during the exercises such as neck, shoulders, chest, thighs, and wrist stretch. First is neck stretch. Slowly tilt the head to the right, bringing the ear to the shoulders. Hold for 10 to 30 seconds, and then return to the center, tilt to the right, and then hold for another 10 to 30 seconds. Next is shoulder stretch. Reach one arm across the chest and then use the other hand to gently press the arm to the chest. Hold for 10 to 30 seconds and then switch arms. Next is chest stretch. Cross hand to the back, pull the shoulder to the back and lift the chest slightly. Hold for 10 to 30 seconds. Next is side stretch. Rest one arm overhead and lean gently to the opposite side. Hold for 10 to 20 seconds. Then switch sides. Next is hamstring stretch. Sit on the edge of the chair with the legs extending out on the floor and with the toes pointing out. Keep the back straight and lean forward slightly from the hips. Hold for 10 to 30 seconds and then switch legs. Next is quadriceps stretch. Stand holding onto a sturdy chair or wall for support. Bend one knee and bring the heel toward the buttocks, holding the ankle or foot with one hand. Holding for 10 to 30 seconds and then switch legs. Next is calf stretch. Stand facing a wall, place one foot forward and the other back. Keeping both the feet flat onto the ground, bend the front knee while keeping the back leg stretched and press gently into the wall. Hold for 10 to 30 seconds, then stretch legs. Next is lower back stretch. Sit on a chair, slowly bend forward, reaching towards the floor. Hold for 10 to 30 seconds. Next is ankle stretch. Sit on a chair, extend one leg straight out of the floor. Point your toes downwards as if you are trying to push your foot into the ground. And then hold for 10 to 30 seconds, then switch leg. Next is wrist and forearm stretch. Extend one arm forward with the palm facing up. Use the other hand to gently pull back the fingers. Hold for 10 to 30 seconds, then switch sides.